Welcome to Every Minute Counts. Hi, I'm Mike Hall, President and CEO of Nature Coast DMS, and this is our program to help their community to reduce the number of 911 responses that they need. In observance of National Heart Month, we have a different subject on cardiac emergencies as they occur. Last week we talked about the warning signs of heart attack, and we'd like to show you a brief clip of a PSA that we produced for that.
When the nightmare is real, don't hesitate. Call 911. Paramedics and emergency medical technicians can begin treatment immediately. They are also trained to revive someone whose heart has stopped.
This is a great reminder for all of us. Today I have Marcine Francina, Director of Cardiovascular Services at Citrus Memorial Health Systems. And we asked her to share, convey with us some of the things that happen when a patient is brought in from the field suffering from a suspected heart attack. And oftentimes they don't even spend any time in the emergency department, they go directly to the cath lab.
That's absolutely true. If we get a transmission from EMS and we can diagnose that the patient's actually having a heart attack ahead of time, we can bypass the emergency room and take a patient directly to the cath lab where they can open the blood vessel that's causing their heart attack immediately. At times people have chest pain that's not that urgent and we don't know before they get here, and those patients typically go to the emergency room and get treated by the nurses and doctors and have a little bit more workup, and then if they need to go to the cath lab, they're sent up there from the emergency room. But our goal is, if you're having a heart attack, EMS gets you, we get the call at the hospital, and you go straight upstairs to the cath lab.
Well, it sounds like time is so important. Why is the time so important in these cases?
Time is muscle, and when you're having a heart attack, your heart is a muscle. That muscle is deprived of oxygen, and it's actually dying. So the sooner we can get you to the cath lab, the sooner the cardiologist can get a catheter up in near your heart and get a wire through the vessel, hopefully, that is blocked, and open that up. And as soon as that opens up, there's blood flow to the heart again. And that's where time is muscle. The quicker we do that, the more muscle we can save.
Well, we talked about the signs and symptoms that are of a heart attack. How important is it for people to really recognize those signs and symptoms as it relates to this treatment?
It's extremely important, and everybody's got different signs and symptoms. One of the things we promote frequently is the differences between men and women. But if you come to the emergency room, even if it's not with EMS, one of the protocols that we have written is that if you have discomfort, not even pain, but discomfort anywhere from your chin to your belly button, front or back, we're supposed to evaluate you for a heart attack.
Really?
The first thing to do is just do an EKG, look at it. We can tell from that initial EKG if there's an active heart attack happening. So any kind of discomfort in your chest, shoulders, jaw, it's sometimes in your back. It's so important to immediately get attention for that. Better to be safe than sorry.
Well, how well do our paramedics interact with the cath lab to make this, sounds like the timing's so important. Is that an important piece of all this?
It's very important. We're blessed in Citrus County. We've got one EMS system, and at this point in time, one hospital that takes cardiac patients. So we can work very closely together. A phone call from EMS saying that we're coming and our staff is ready. If it's the middle of the night, the staff's on call 24/7. They will be at the hospital within 30 minutes. So by the time EMS is typically at the hospital with a patient, we can have the staff there getting ready. If it's during the daytime hours while we're running a regular business day, we'll stop everything that's going on with scheduled patients, and the EMS crew is the first ones in the room.
Wow,
so
that's impressive.
It's important. It's good partnership, very good partnership.
Yeah, that's great. That's great, and sounds like a great system. Yeah. And what makes your hospital different from some of the hospitals that aren't receiving hospitals for these type of these patients?
We're a complete heart center. We have everything from diagnostic tools to rehabilitative tools, but as a cath lab, we are a level 2 cath lab, which means we can take patients, we can do diagnostic studies, interventional studies, which is what we do when a patient's having a heart attack. We can put balloons and stents in people's hearts and open up those blood vessels. And we have an open heart program. Our open heart surgery suite is 2 doors away from the cath lab. So if a patient can't be fixed with a cath, they can go directly to surgery if that's what's needed to save their life. Oh, wow. So we're very blessed. We're set up in a way that everything's 2 doors away from each other, and it's wonderful.
So patients that have a blockage may or may not need to go have surgery. They might be able to get treated some other way? Absolutely.
Very frequently, and more now than years in the past, we can treat blockages with stents and balloons, open those clots up and put a stent in there that holds the blood vessel open to the point where it can heal.
That's
Yeah.
interesting, interesting. Well, thanks so much, Marcy, for
You're
sharing
very
that about
welcome.
what's happened in the cath lab, and I hope that shows all our viewers kind of what happens in an EMS system so we can work with all the providers that are out there. We'd like to show you a little clip from the American Heart Association that shows some of the latest standards and changes that have happened in CPR. Wow, things have changed with CPR, and it's very interesting to see how the American Heart Association has gotten that information out, and they've changed the standard so we can more effectively do CPR and hopefully save more lives. Well, on our next segment, we're going to speak with Jane Bedford, who's the American Heart Association Training Center Coordinator at Nature Coast EMS, to tell us a little bit about what has changed in CPR and how you can learn and yourself so you can have that learn that life-saving skill. So we'll be right back after these messages. Well, welcome back to Every Minute Counts. I've asked Jane Bedford to come and speak about what are the new changes with CPR and how people can learn what these new changes are so they can perform these life-saving skills.
Well, thank you, Mike. I'm happy to be here. American Heart Association has made some definite, drastic changes to the way we do CPR. A half a century we've been doing breaths, and then we've done compressions. They've decided through research over the years that they've got, matter of fact, it improves the outcome of patients, that the compressions are where we need to focus all our energy. So the breaths have gone away. So for the public, now when they do CPR, all we're going to ask them to do are compressions. The American Heart Association saw a great hesitation in the public of doing mouth-to-mouth, especially on people they didn't know. And that delay kept people from doing compressions. And so now there is no more mouth-to-mouth in CPR. It's only doing compressions. You're going to push hard, you're going to push fast, and you're going to try to get at least 100 in a minute.
Wow. So what was the big science that changed? What made him? Is there something that happened, or is it just general research, or how did they do that?
A lot of research went into the changes, and what they saw is that in a study that they did, that the increased survivability of CPR went from 18 to 37% when they stopped doing respirations. So that was significant. That would convince anybody that we need to stop doing the respirations and we need to just get on the heart and start doing the compressions. And at Nature Coast EMS, we've seen that significant change too. We saw an increase in our out-of-hospital cardiac arrest patients from where we were was the same as the national average when we first started this process to where we are now, which is 8 times better than the national average. If you have an out-of-hospital cardiac arrest in Citrus County and you dial 911 and Nature Coast EMS responds to your emergency, your chances of getting a pulse back, viable circulation, is 8 times greater than the national average.
Wow, that's impressive. That's impressive. So what can people do to learn this new CPR? How can they pick up that knowledge? How can they figure out how to get this done?
Well, we encourage everyone to learn CPR. Families with children, people who work in a workplace, and we can offer that education to everyone. And we do it once a year during our EMS week. We do a free CPR class for anybody that wants to learn it. But if in your workplace or for your job you need CPR training, we are the only American Heart Association training center in Citrus County, and we do offer that education for workplace CPR and for healthcare provider CPR. And there's also an avenue available to people who just want to do it in their home. And that way they can order a home kit. Actually, it comes with a little blow-up mannequin, and then they can learn CPR in their home with a videotape.
Wow, that's neat. Well, people ask us a lot of times, there's all these different types of CPR courses. What type of CPR course should people just take, or what's the basic one that people should target to take to learn?
It depends on what their need is. And not a lot of people don't know that, but in Citrus County, it is required, actually in the state of Florida, it's required that all students, before they graduate high school, get CPR. So you're going to get it once as a student in Florida anyway. But if you weren't a student and you wanted to learn CPR, it would depend on what you wanted to learn it for. If you only thought that you would be given CPR to a bystander, your husband, your wife, a family member, or you were going to use that AED in the airport, in the event, you might only need to take what we call heart saver CPR, which will just teach you the basics for an adult. But for healthcare providers like nurses, doctors, paramedics, and anybody who works in a healthcare field, we have healthcare provider CPR. And then the class that we offer for free is what we call Friends and Family CPR. It's an overview of CPR where you get a lot of time on the mannequin doing the push hard, the push fast, the compressions, so that hopefully we get it in your mind so that if you ever had to do it, you remember how to do it. That doesn't give you any kind of a certification, but it does give you the information you need to do and to learn CPR.
Well, that's great, Jane. Thank you so much. And if for anyone who wants to learn CPR, we do offer it at Nature Coast DMS. You can call us at the number that's on your screen, or you can look us up on the website at naturecoastdms.org. We train our own staff. We train many people throughout the community on CPR and all the different levels that would be available. So we'll be right back after this break.